The impact of obesity, pregnancy, aging, and of course genetics play a big role in who out there will develop varicose veins. My next guest, Dr. Joseph Jensen, is here to explain treatment options for those suffering from the unsightly and often painful condition. It's great to have you.
Nice to be
here.
I
named a few causes of varicose veins. Would you say most women then are at risk for developing varicose veins at some point in their life?
Over half of women get varicose veins.
Half of women. What treatment options? Let's get into the treatment, the positive side of the street. What's available?
So, you know, I always advocate good, healthy living, exercise, nutrition, elevation of your feet, compression hose. But once that isn't enough, which it isn't for over half of women in their lifetime, then there's two main procedures that we do in the office to treat varicose veins. The first is called endovenous ablation.
Okay.
In endovenous ablation, a small catheter, now this is going to sound horrible, but it's actually an easy thing to go through. A small catheter is inserted into the vein to be treated, and you numb up the vein, and then the catheter cauterizes the vein from the inside. That causes the vein to disappear. Now that's a simple procedure done just with a couple needle pokes.
And you're eliminating the vein in that case.
Right. That's the substitution for stripping the vein, which was a horribly morbid procedure that people avoided. This is a simple thing. You come to my office, you smile and giggle, and I poke you a few times, and that's the end of it.
Do you find people still, though, associate with those old stories about the vein stripping and think that it's just not something they want to get into?
I tell you, it's hard sometimes to convince people when they first come to see me that it's going to be an easy process. It's always a surprise.
Who's a good candidate for that procedure you just described?
Anyone, because it's so simple. You know, people suffer from leg pain and painful and varicose vein problems, and they avoid seeing the doctor because they imagine horrible things like stripping. And really, if they knew that they could just come in and crack a few jokes with me and listen to some good music while I'm working and walk out with no activity restrictions and virtually no pain, they'd come and see me more often.
Well, gosh, you almost make it sound fun. You almost make it sound fun.
It's fun for me.
The results you can see, we saw a couple of before and after pictures. Clients are really pleased. Yeah,
people are surprised, you know, that with such an easy process, they can get such a great result. You know, I've been in practice for 12 years. It's one of the funnest things that I do because it's an easy process and it's a happy ending.
How can people set up a consultation? Okay,
I've been working on my website for over a year. We've tried to make it a really content-rich place. There's patient testimonials, there's educational materials, there's my contact information, of course. There's always a special. Right now there's a $8 unit Botox special. But just go to my website, drjosephjensen.com, and schedule a free consultation.
All right, sir. Thank you so much.
Thank you.
We appreciate it.